This is Dr. Nicholas Jory, Chief of the Orthopedic Surgery Service at the Palo Alto VA Hospital. Welcome. On behalf of all of my colleagues, we are honored to care for you. In this presentation, we will discuss how to prepare for your hip replacement surgery and what to expect before, during, and after your hospitalization. We want to maximize your chances of success. We need your help with this. In the months before surgery, it will be very important to do the following things. First, keep yourself healthy. Your heart and lungs need to be healthy, and your blood pressure and diabetes need to be well controlled. Check with your primary care doctor at your next checkup to make sure that you are ready for the operation. Second, take care of any needed dental work at least 6 weeks prior to your surgery date. Third, minimize your use of pain medications. People who are taking a lot of pain medications prior to surgery can have a hard time controlling their pain after surgery. If you are taking narcotic pain medicines like Vicodin, hydrocodone, oxycodone, or morphine, work with your primary care doctor to reduce or eliminate these medications prior to surgery. Fourth, minimize or eliminate your use of alcohol and your smoking. It has been shown in multiple studies that people who smoke or consume too much alcohol have more complications and worse outcomes after joint replacement surgery than people who don't. It is very important that you keep yourself in good physical shape. Be as active as your hip will allow. If you are in good physical shape going into surgery, you will have a much easier time recovering from the operation. You will be visiting the hospital for a preoperative appointment within 1 month of your scheduled surgery. At that visit, you will meet with a member of the orthopedic surgery staff who will be doing a physical examination. You will get blood tests done, may need to have new x-rays taken, and you will need to sign the surgical consent form. You will also have an appointment with the anesthesiologist who will make a final check regarding your medical suitability for surgery. At these visits, you can ask questions regarding your upcoming surgery. In the month before surgery, it is very important for you to arrange your travel to and from the hospital. You may not drive yourself to the hospital for surgery because you won't be able to drive yourself home. Find a friend or family member who will be available to take you to the hospital on the morning of surgery and who will be available to pick you up from the hospital 1 or 2 days after surgery. This is very important. Your surgery may be canceled if you do not have a ride arranged. If you are unable to arrange transportation, please let us know well in advance of your surgery day so that a member of our team can assist you. Also, set up your home for success after surgery. Clear out all obstructions and clutter. You need to be able to get around your home easily with a walker. Make sure pathways inside and outside your home are well lit at night. You need to be able to see to avoid tripping on things. Remove any throw rugs. It is easy to trip on their edges. Get rid of chairs or sofas that are low and hard to get out of. It is best to sit high so it is easy to get up from sitting. Get chairs with armrests that you can use to help yourself stand. Finally, watch for pets that may walk or run in your path. We have seen too many patients trip over their pet and get hurt. The bathroom is a particularly easy place to slip and fall. Use a bath mat or non-strip slips in the tub or shower. You don't want to slip and fall when you are bathing. Reinforce any loose support rails. You will be needing them to support you after surgery. Also, get an elevated toilet seat. This will make it easier to get up after going to the bathroom and will reduce your risk of dislocating your new hip. If you are taking anti-inflammatory medications such as aspirin, ibuprofen or Motrin, naproxen or Aleve, diclofenac or etodolac, you will need to stop taking this medication 5 days prior to your surgery. You will receive other instructions for other medications. Most medications can still be taken up to the day of surgery. On the evening before surgery, you will receive a call from our preoperative nurses who will tell you when you must arrive to the hospital and where to go. Do not eat or drink anything after midnight on the day of your surgery. Before you leave home, there are a few things you need to remember to bring. To best take care of you, it is important that you bring an accurate list of your medications. Also, if you have sleep apnea and use a CPAP machine at night to sleep, remember to bring that too. On the day of your surgery, you will come to the 3rd floor of the Palo Alto VA Hospital and check in on Ward 3A, Outpatient Surgery Services. This is the same place you came for your anesthesia preoperative appointment. You will change into a hospital gown and have an IV started. When you are called for, you will be taken by gurney to the preoperative holding area. Here you will be seen by the entire surgical team, including your surgeon and assistant surgeons, your anesthesiologist, and your operating room nurses. Your anesthesiologist will discuss anesthesia options with you, and you will also have a nerve block placed for pain control after surgery. If you have a friend or family member with you, that person will be with you until this point, and then may wait in the surgical waiting room. Once the operating room is ready for you, you will be taken to the operating room. Your surgery should take about 2 hours. During surgery, the arthritic bone surfaces of your hip will be cut away, and those surfaces will be replaced by ceramic and plastic surfaces. This is an example X-ray of another patient who has hip arthritis. Before surgery, you have bone rubbing on bone, which is painful. After surgery, you will have a ceramic prosthetic head rubbing against the plastic socket. This should reduce your pain. After the operation, you will be taken to the recovery room. Here, you will be monitored to make sure you recover well from the anesthesia. X-rays of your hip will be taken here, and once you are ready, a friend or family member can see you here. You will be here for about 1 hour. Most of our patients will spend the rest of their hospital stay on Ward 3C. We have outstanding nurses who will look after you and will help you have a safe recovery. This is what one of our hospital rooms looks like. While you're an inpatient, you will see many people who will be involved in your care. Your surgical team will take care of your surgery-related issues. The anesthesia team will take care of your pain. An internal medicine doctor will oversee the care of all of your other medical issues. The occupational and physical therapists will get you moving and start you on the path to rehabilitating after hip replacement surgery. The social worker and discharge planner will help you make any arrangements that will aid in your discharge from the hospital. The physical therapist will get you out of bed either on the day of surgery or the first day after surgery. Do not get out of bed on your own after surgery. You may fall. The therapist will work with you to get out of bed safely and will let you know when you are ready to do this on your own. Based on your performance with physical therapy, we will develop a safe discharge plan. If needed, we may arrange a short-term stay at a rehab facility or home with additional therapy. It is important to care for your hip and avoid certain motions that may increase your risk of dislocating your hip. The physical therapist will work with you to help you avoid putting your leg in a bad position. Let's go over some of the precautions you should remember after hip replacement. First, when you are sitting, you should avoid flexing your hip more than 90 degrees. Second, you should avoid crossing your thigh across the midline of your body. Don't sit with your legs crossed like this. Third, you should avoid turning your thigh inwards as is shown in the photo on this slide. You really want to avoid doing all three of those motions at the same time. The most common way for people to get into trouble is when they are in a seated position and try to pick something up from the floor. The right way to do this is to reach between your legs. In this position, because your thighs are pointing away from the midline of your body, it is safe to flex your hip to reach down and pick something up. The wrong way to pick something up is to reach down the side of your leg. This forces you to flex your hip, cross your thigh across the midline of your body, and internally rotate your thigh, all at the same time. Don't do this. Another common situation where people get into trouble is when they are reaching down to tie their shoe or put on their sock. Our occupational therapist will give you a tool to make it easy to put on your socks. You may want to get slip-on shoes so that you don't need to tie your laces. If you need to tie laces or reach your feet, reach between your legs. This forces your thigh to point away from your midline and puts you in a safer position. The general rule is that if you need to reach down, reach between your legs. Your occupational therapist will visit you and will address your self-care needs, such as dressing, bathing, and toileting. If you need special equipment at home to help you with these tasks, this will be arranged and provided before you are discharged. The occupational therapist will ensure that you are comfortable with the use of this medication before you go. On the left, you can see a tool that will help you reach to clean your legs, and on the right, you can see a tool that will help you put on your socks. Nearly all patients have pain after surgery. This is normal and expected. Before surgery, your anesthesiologist will give you a numbing injection called a nerve block. After surgery, your anesthesiology pain management team will see you every day to help adjust your pain medicines. You will have a combination of pain medicines that work in different ways to treat your pain, not just narcotics. Ice your wound and keep your leg elevated while you are resting. Most patients can go home after surgery. You will be ready to go home from the hospital if you can walk 150 feet, can go up and down a flight of stairs, and can go to the bathroom on your own. Your therapist will work with you to achieve these goals. You must also be able to tolerate your pain with oral medications. Most patients can go home 1 or 2 days after surgery. You cannot drive yourself home. Make sure that your ride is available to pick you up when you are ready to leave. This is very important because we need open beds in the hospital to care for other veterans like you. We want to take care of as many veterans as we can. If you are here an extra day because you don't have a ride, another veteran may not be able to get the hospital care that he or she needs. After you return home, elevate your leg above your heart at night and anytime you have a lot of swelling in the leg. Apply a cold pack that is wrapped in a towel to the surgical site to reduce pain and swelling. You will receive a call from our team to check up on you. You will have an appointment for a wound check at about 4 weeks after your surgery. When you are home, remember your hip precautions. If you need to reach down, reach between your legs. Pain, swelling, warmth, and mild redness at the incision site is normal after hip replacement. Increased pain and swelling after an active day is also normal. Concerning signs after surgery are the following: increasing wound drainage, steadily increasing pain, leg swelling that will not go down even after a night of leg elevation above the heart, and high fevers. If you experience these concerning signs, call the hospital advice nurse at 650-493-5000. Many patients ask how quickly they can expect to recover. This is highly variable from patient to patient. By 2 weeks after surgery, most patients will be off narcotic pain medications. By 6 weeks, most patients may be able to return to driving and to desk work. By 4 to 6 months after surgery, some patients can return to more physical work. Full recovery can take up to 1 year. Ultimately, many patients are able to return to activities such as walking, bicycle riding, golf, and swimming with less pain than they had before surgery. Your prosthesis is not able to withstand the forces associated with vigorous sports like soccer or basketball. From all of us at the Palo Alto VA Orthopedic Service, we hope that this presentation helped to prepare you for surgery. We appreciate the trust you have given us and look forward to caring for you.